The North Carolina Pediatric Society is a great source for education, particularly continuing medical education for the pediatric providers across the state. Our educational efforts are driven by our membership. We survey the membership with regards to topics that they most want to hear about to provide care to their communities. North Carolina is a wonderful community, and the Pediatric Society provides that opportunity for providers not only from the central part of the state, but the western part of the state and the eastern part of the state to come together and create a common ground that helps us to advance the care for our children and families.
The programs that the North Carolina Pediatric Society has been instrumental in establishing just are not there in many, many other states. And they're not going to be there unless pediatricians are organized and unless pediatricians have the financial support of their membership. And if we let people who don't know very much about child health administer our programs without our collaboration and co-leadership, we're not going to have good programs. I think our role as advocates is key, and it makes a huge difference in access for children and access for families, and of course physician income, because if we can't keep our offices open because of poor Medicaid reimbursement, nothing happens.
Sometimes, especially in a small practice, when you're not in the big city, when you're not in Charlotte, when you're not in Raleigh, you encounter very different problems, and it gives you resources to help you collaborate and to problem solve in your own community. One of the things I think was very, very helpful was that through the Pediatric Society, I learned about the program called Reach Out and Read. I'd never heard of it before, and a number of years ago when it was introduced, it allowed us to tap into resources that will help early literacy for our young children. Us being able to give a book to a child in the very early years, from 6 months to 5 years, allows us to encourage literacy from the home. One of our most recent programs works with kids that are in the foster care system.
The foster care work aligns really well with the Society's mission in that this work is focused on building sustained systemic change to improving outcomes for children and youth with special health care needs.
We are the voice for children. They don't have the resources or the wherewithal or the vote to speak up for themselves, and so we need to be their voice.
Because of our expertise and our commitment and our passion for what we do, we've been incredibly successful in creating good programs for children and families and pediatricians in North Carolina.
I say to providers and to medical students and residents that if you want to know more about the state and the children that we serve and the families that are part of these communities, that becoming involved with the North Carolina Pediatric Society, whether it's our educational programs or some of our advocacy programs or our community programs, it's just a wonderful opportunity to do that.